My producer Denise, she actually just told me in my ear because apparently she suffers from allergies, and she wanted me to ask you about the Neti pot.
Yes. So
what do you think about that?
Well, Neti pot is important for some people, and it helps them sort of flush out their nasal passage. You know, our nose obviously is connected to the back of your throat, and you know that whole respiratory is part of your upper respiratory tract. So if you're able to flush that out and alleviate the irritation and the inflammation, then great. However, I like for patients to be careful for a couple of different reasons. It's important that part of the elaborate evaluation of a patient that has really severe allergies also be a good ENT evaluation. So I may bring in an ENT, sorry, ear, nose, and throat. Sorry.
Okay, no problem.
You don't want me to pronounce the whole, okay.
No, but I wanted you to find it.
Good, because I'd have to say it in Spanish. But anyway, so ENT is an ear, nose, and throat doc. And an ear, nose, and throat doc can do what's called a nasal pharyngoscopy. And a nasal pharyngoscopy is basically a tiny little flexible camera that looks into your nose and all the way back into all the way to your vocal cords. That can evaluate for obstruction, irritation, infection, etc., which is a little bit more elaborate than what most primary care physicians do in their office. Our little looking in your nose things only looks so far.
Right, that goes a little bit more in depth.
Correct.
A lot more in depth.
So if you're gonna neti pod yourself, it would be a good idea to be sure that your passages are, let's say, open and amenable to that kind of stuff, because you may be pushing against something that is physically obstructing, and you can neti pod 100 million times and it isn't going to get you necessarily better. So again, we have to be careful, and good history taking is the most essential tool for a physician. Period.
Very important.